The experience of pain, as you mentioned, is very individualized, and no two pets, no two people will experience pain in the same way, because it's that conscious perception of what that pain is.
Man scratching like a three-legged dog.
For any tripod, cat or dog.
Why do some vets do things that way? Why?
So many people don't realize that their dogs are in pain.
He's a three-legged dog and he's still pretty good.
Hello again, and welcome back to Tripawd Talk Radio, where we share inspiring stories and expert advice for anyone caring for three-legged dogs and cats. I'm Jim, the man behind the curtain at Tripawds. Today, Renee is talking with another veterinary expert about one of the biggest concerns all our community members carry into surgery, through recovery, and beyond: pain. Specifically, proper pain management. Our guest is British veterinarian and anesthesiologist Carl Bradbrook from the team at ZeroPainPhilosophy.com, a training and education resource providing vets and pet parents more accessible, evidence-based guidance. And just a side note, in the UK, veterinarians are not referred to as doctor, so that's why you'll hear us calling him by his first name. Carl is a veterinary anesthesia and pain management specialist with more than a decade focused on helping cats and dogs feel better after injury or surgery and through chronic pain conditions. If you have a tri-kitty or cat facing amputation, this one is for you. Our conversation is especially for cat parents because cats can be incredibly stoic. They often hide discomfort, and they can react differently to medications, and it can be hard to tell if they are healing normally or struggling. So, Carl breaks down pain management into 3 phases: before surgery, during the hospital or anesthetic period, and after you bring your cat home. We talk about why amputation pain can be so intense, how long-standing injury pain can wind up the nervous system, and why pre-treatment can still help even if it only starts a day or 2 before surgery. Renee also digs into the common medication categories used for cats, including anti-inflammatories, gabapentin, and other options for nerve pain, when opioids matter most, and why local anesthetic nerve blocks can be such an important part of the surgical plan. And because so many have asked at Tripawds over the years, we spend time on what phantom pain can look like in cats. Plus, what to watch for at home so you can tell the difference between medication side effects and pain that may not be well controlled. As always, nothing you hear today replaces guidance from your own veterinarian. But our goal is to help you ask better questions, recognize red flags sooner, and advocate for your cat with more confidence. So let's get into it. Here's Renee's conversation with Carl Bradbrook.
Carl, it is so nice to have you here today. Thank you for joining us. I can't wait to talk to you.
Pleasure. Thank you very much, and amazing. Thanks for the invitation, and really excited to talk about loads of stuff related to pain management and the work that you guys are doing as well.
Well, you are certainly an expert in the topic, and I'd like just a little bit of backstory on you real quick. What got you focused on helping pets with pain management in the vet world?
Perfect. Yeah, thank you. So I've been a specialist, so an anesthetics pain management specialist for about 12 years now. I graduated as a vet back in 2002, so a few years ago. And then I spent quite a bit of time actually doing what we would call mixed vet practice then, so all species work for a few years. And then I moved on to do a residency in anesthesia, pain management, intensive care. And then for the last sort of 7 years, I've been based down in Hampshire, so down in the south of the UK. And I'm in a big hospital there, so a multidisciplinary hospital, where obviously we're dealing with both acute pain management, so exclusively dogs and cats now in the clinic. We don't deal with any other species on a regular basis. And as part of that, then we're dealing with obviously the surgical, acute, traumatic type pain. But a lot of those pets will present where they've got more chronic pain, for example. So we'll be helping to manage that. And as a part of that, then we have a pain clinic for owners that want to bring their pets for more kind of management of their chronic pain conditions as well. So that's really the kind of my day kind of focus. and the work that I'm involved with the team in the clinic. So we've got a team of 4 specialists that work in the hospital. As a bit of a then kind of an interesting kind of the pain stuff is really exciting. It's ever evolving, and
Yes.
there's so much information out there that we really, I said myself and Matt, we recognise that from a training point of view for the general practitioner vet who's presented with everything and is trying to get the most up-to-date information in a single space that's a reliable resource for them, that there was an opportunity for us to help out there in terms of using our expertise and knowledge to summarize information, put stuff together, bring people together. And that's where zero pain philosophy came from. And we did that initially actually with a friend of ours who's a surgeon, a veterinary surgeon, a surgical specialist in New Zealand. And it kind of grew from there. That was in about 2016. And
Nice.
like a lot of things, COVID changed the way that we were practicing and working. We had a bit more time on our hands. We weren't doing other stuff. And that really allowed us to expand then the online kind of presence that we have. And that really then grew. So Zero Pain kind of grew out of that in a bit more of an accessible way. Webinars, the pain updates, knowledge summaries, and then we find ourselves now in where we are. So trying to also move to provide information for the pet owner as well as for the veterinarian. That's kind of where we've got to on the journey so far.
It's amazing how far it's come because of vets like you. And I can say that because Tripawds has been around since 2006. So we have seen pain management evolve. I've seen it with my own animals and our community as the years have gone on and people are sharing their experiences. We can see, the medications are getting a little more dialed in when it comes to controlling amputation pain and it's exciting. And it's because of vets like you getting the information out there so that old way of thinking that, a dog can just go home after surgery and just be fine a few days later. That's going away slowly. We love it. We're super happy to see more and more pets having some kind of standard medication protocol when they come home. But we're also learning that every animal responds differently to pain and to the pain medications they're given. So it's never a one and done, and there's no recipe for every single pet that has an amputation. So that's why we love talking to vets like you, so we can get a more well-rounded experience. So I wanted you on today so that not only we could talk about amputation surgery pain in general, but also to talk about cats, because felines get the short end of the stick when it comes to pain control. They're so stoic and they handle pain. And I don't even like to say handle pain because nobody should have to handle pain, but they deal with pain so much more stoically than dogs. And it's so hard to tell when they're hurting. And pet parents are getting better at recognizing it, I think, because of the information that's being provided, like the feline pain scale and the grimace scale is another one. We have a link to that in our blog. I'll share in this podcast, but it's gotten better, but we still have a long way to go. So thank you for sharing this with us today. And I'd like to start with just a general overview about how amputation surgery can provoke pain in the body. What is it about cutting those nerves that makes it such a high level of pain that we've never had to deal with as pet parents, and even a lot of veterinarians don't see a lot of when it comes to surgery?
Yeah, it's a really good question. And I would like to say as well, I'm a real cat lover. I've got 2 cats.
Aww.
So they have a particular fondness for them. And we did have, a few years back, I did have our own amputee.
Did you?
So he actually, when I rescue, he was a rescue, and he done amputation prior to me rescuing him. But he was a great cat. He was quite a character, as they all are.
Yeah.
But in terms, I think the pain question is a really good point, because for me, I think the focus is thinking that it's not just what we're doing from a surgical point of view, but these cats and other animals that will present with more chronic and long-standing pain, because usually by the time we've reached the point of amputation, and in a lot of cases, obviously not in traumatic injury, for example, but the cat will have experienced pain for perhaps quite an extended period of time. So you're reaching the point of obviously making the decision for amputation, which you shared. It's not always a straightforward or an easy decision particularly for the pet caregiver. And then on top of that, we are creating surgical pain. So what we would call nociceptive or inflammatory pain, which is the pain then centered around the surgical procedure itself. Mm-hmm. Now, you touched on that there's nerves involved, and that also means that those nerves at some point, they've got to be cut as part of the procedure. And if we haven't quite got on top of the pain management at that point, it's very likely that those nerves are going to be sending signals as they are cut, for example, that then might have an impact on how that animal, that pet, that cat experiences pain in the post-operative or the post-surgical period. But if you can imagine that if I've got like a chronic injury and then a decision is made, months, weeks later for me to have an amputation, in that preceding period, the nerves in that area will be continuously being like firing. And it's that plasticity within the nervous system that makes these changes and what we would call the concept of developing chronic pain. So the cat may have that before they even then have the surgical procedure to perform the amputation.
That is really interesting. So what you're saying is that we have an animal who maybe they look like they're getting around okay, hopping around. A lot of people join us and say, well, my dog or my cat's already on 3 legs, so they should be okay. But during that time they adapted to 3 legs, they're probably experiencing some kind of pain related to whatever injury or illness they're dealing with. So you're saying that in that time, whether it's a year or 3 months, those nerves are getting angrier and angrier over time?
Yeah, I suppose that's a good way to think about it, that they are, I think, nerves are there to send a signal to somewhere else in the body, usually via the spinal cord. That's the first point where the nerve will go into the more central part of the nervous system, and from there to various parts within the brain, for example. And that's how we then experience pain, or the experience of pain, as you mentioned, is very individualized in terms of how the pet or the person would experience it. And no 2 pets, no 2 people will experience pain in the same way, because it's that conscious perception of what that pain is for the individual that's the really key part. And I suppose one of the exciting things for the future is going to be around more individualized management of lots of diseases, but pain is one of them, really, where from a genetic perspective, there'll be a better way to manage the individual's experience of pain. But you're right, taking that back to if you've had an injury and those nerves are essentially they're like being irritated. So there's been an injury, then those nerves don't stop firing, and because those nerves keep on firing, the other parts of the nervous system will adapt in a way that then means that pain processing within the nervous system is no longer what we would say is normal. So that's when we get something that we call maladaptive pain. So all that processing is different. It means that different parts are firing, and all of that put together means that the pain experience for that cat, that pet, will be different even before we then decide to go ahead with amputating. So I suppose one of the things that I like to think about, and that I encourage people to think about, is perhaps how we manage the pain in the pre-surgical time. Yeah. And that's really something to think about. And then if we've not been able to manage that, because sometimes you can't, for various reasons, get a great handle on it. And as you mentioned, cats are very stoical about how they express pain and how they experience it. But what we can do then is try and get on top of it as part of the whole of the management around the surgical procedure. So the kind of the peri-anesthetic period, we can do different pain ways to manage that pain at that time point that will have a positive impact on the recovery from the procedure. So that's the middle bit, and then obviously there's the post-op part as well, and that's the focus. I was kind of trying to split it into three different segments, really: pre, during, and around, and then post as well.
Well, that is so helpful to think about it that way. As pet parents, we don't really deal with the during part, during the surgery. I'm not going to tell my veterinarian what I think they should be doing for that part. We know there are standards involved when it comes to surgery, pain treatment, and anesthesia, of course, but generally we experience the pre and post with our pets. So in the pre-surgery part, how much time do you think is needed to get an animal into surgery so that when they come out, that pain is better controlled? Can we have in a week, would we be able to give our animal better pain control so that the recovery is better? Is it a day? I often see nowadays veterinarians starting gabapentin and maybe another medication a day or two ahead of surgery. Is that at all helpful?
The answer is yes, it will be. So I think whatever we can do will have an impact in a positive way. So all of those, all of those interventions, all of those treatments will make a difference compared to having not used them.
Okay.
I would probably suggest that we don't have enough information, enough data yet to say how long that period of time would ideally be. But there'll always be a balance between delaying the procedure and using those pain management interventions beforehand. So I can't imagine we'll reach a point where we're going to delay surgery, for example, for a month because it's great to get a month of treatment, because in that time lots of other things will be happening as well. So we do have information, for example, you mentioned around some of the products that are there. So gabapentin is one of the medications that might be used. We do have information to support actually that these drugs do act quite rapidly, and they will start to reverse some of the changes that have already happened in quite a short space of time. That doesn't mean they're going to reverse all of the stuff that's happened, but they will start to help and to make a difference. So you're right. It's interesting that you mentioned that there's already veterinarians out there that are starting to do some pre-treatment, and that's definitely going to benefit from a both an intra and a post-op perspective.
Oh, that's really good to know. That is so good to know. Now, how does it's funny because I mean we're here to talk about non-human animals, but when it comes to humans, is our pain experience in a situation like this similar to our cats and our dogs?
I think the honest answer is yes. I mean,
Really?
the nervous system in terms of how things are processed is very similar. In fact, is the same. So we will always be learning from our medical colleagues in terms of what they're doing and what they're thinking about, but things don't always completely translate through into veterinary medicine just from a species difference. But in terms of the actual kind of makeup of the nervous system and how that functions, absolute similarities there. It's then whether the products are the same and whether we use them in the same way. Those are the kind of the nuances. But what you mentioned before, which I think is the fascinating bit for me, whatever the stimulus was, whatever happened to cause the pain in the first place, how the individual, whether that's me as a person or my pet, those things will just appear differently depending on everything that person, everything that pet's experienced, as well as their genetics. So that's the fascinating part, and that's why we see it looking different, cat versus dog, person, for example. So, and there's lots of stuff out there now, particularly in people, where they're looking at the way that a different person responds to pain, or say differently to someone else. Could be genetic, but it could be just the whole of their life experience to that time point. Wow. So there's some really interesting stuff that's coming out.
Yeah, and I think what I'm hearing you say then is that we all express pain differently, the consequences of pain, physical and mental. But pain is universal. We all
Yeah.
feel it when it happens. We all know it's there to some degree. And I love that this thinking has just come so far, because when I was a child, it was like, dogs don't feel pain, cats don't feel pain. Why would we treat that? So it's so hopeful to see that in my lifetime this has come such a long way. And that kind of touches on phantom pain. And that's a big deal. But I think I'm going to talk about that later, because we're going to talk about that in the post-surgery um, era of talking about this. But right now, I want to talk to you about medications that might be effective when controlling pre and post-op pain in cats. We're going to focus on cats, like I said, because they get the short end of the stick, and we have lots of information about dogs. And I don't even know if the medications are the same. So I'd love to hear from your perspective. What are some of the more effective protocols that you're seeing to help in this kind of situation when a cat needs to lose a leg?
Yeah, good question. And then there definitely are some differences from dogs in terms of what drugs we can use. So that's really important. I think I'll just mention, I think it's important that I mention this, particularly if this is going out in other kind of areas in terms of regions of the country, so of the world, I should say, that in the UK, where the regulations are somewhat that we can't necessarily directly advise clients that are not our clients in terms of options. So just to say that from a regulatory point of view, I'd always encourage everybody to obviously get advice from their own veterinarian before
Definitely.
they're going down the prescribing route. But you're right. You mentioned gabapentin earlier, which is a drug. Very interestingly, it was originally developed as an anti-epileptic and anti-seizure medication in human medicine. But as part of a lot of these drugs, when they go through clinical trial, they found that it did have some benefits in terms of pain management. So that's where it kind of originally came from, is used in human medicine, and is something that we know is effective for treating what we would class as neuropathic pain. So where there is pain with a nerve element. Now that could be, for example, nerve dysfunction. It could be nerve damage. Obviously, these cats may have nerve damage already as part of their initial injury. And then we almost certainly will cause some sort of nerve trauma damage as part of the surgical procedure as well. So gabapentin, or the gabapentinoids, we are aware they will be effective for that type of pain. So if we think we've got pain that's related to the nerve itself, which is very likely when we're talking about amputation.
Now, gabapentin in the form that it's given, is it more effective in, let's say, a capsule or a tablet or a transdermal in the ear for cats? What do you see?
Good question. So we don't have any evidence to suggest that the route of administration is going to impact on that. So we are generally giving it orally in the majority of cases. I think what I would say, being a cat owner as well, is a lot of the time it's around trying to medicate the cat and the challenges that can be associated with doing so. And particularly as most cats are pretty good, once you've given something once and you think, oh, I've won here, because they'll take it, is the next time you try and do it in the same food or the same treat, they're like, well, I'm not going to eat that now. So why do you think I would? And I think that's where we see the challenge with cats, really, is around actually palatability, which we don't see as a problem with gabapentin. So we're really lucky in the UK. They make some formulations that are flavored with things that cats supposedly like, chicken, for example. So those kind of things help. And the size of the tablets is obviously, or the volume of liquid that you need to deliver as the medication dose is obviously really important, because cats are pretty fussy about taking things if they can find them in the food, aren't they? They'll soon, they'll eat everything else or lick everything else before they take it. So those would be the main kind of ways that we would do that. So, but you're right. From a point of view of actually getting the correct dose and wanting that to be effective, we don't have anything to support that should be different across medications.
Okay. All right. So before I interrupted you, you were going to talk about another medication, I believe.
Yeah, absolutely. So what I wanted to go back to, just we were talking before about the fact that there's very likely going to be chronic pain associated with
Yeah.
the situation before we even go to do the surgery itself. And one of the classes of drugs that we have an amazing amount of evidence to support and a great safety profile. They're one of the probably the most common of the licensed medications across multiple countries will be the anti-inflammatory drugs, so the non-steroidal anti-inflammatory drugs. And you and I will know that as something like ibuprofen. We're definitely not going to be giving ibuprofen to a cat, but we will use some of the other medications, and there's many of them now. There's lots of different options that are available. And again, we don't have evidence to say that any of them are superior to another one. So it's usually then down to what does your veterinarian stock, because they won't maybe stock every single one of these drugs. Mm-hmm. And again, how we might want to give that to our cat. So there are some that are liquids in like a syrup based. And again, there are others that are tablet based, for example, as well. So it will be very much what's the easiest way I think of that I'm going to successfully get my cat to take the medication, because those are daily medications to give. And in my experience, the syrup-based ones are much easier. They're certainly, if I'm trying to medicate one of our cats, that would be my kind of preference. But those are anti-inflammatory painkillers, and we know that when there's tissue damage, any injury, you know it yourself, don't you? You might get some swelling, you might get some heat associated with that. So these drugs are really effective at reducing inflammation, and we know that inflammation causes pain. That's part of what's happening. It's that kind of continuum of going from the initial injury onwards. So if we can reduce inflammation, we're likely to have a positive impact on pain as well. So they're really effective in the initial injury, pre-surgery, if that's a traumatic injury, or actually the cat arrives and you notice that something's happened. But they'll also be effective for the surgical part of the procedure as well as post-operatively as well. So really super effective for good pain management.
And are non-steroidals or NSAIDs, they're safe for cats? I thought I had heard that they weren't.
No, that's a really good question to pick up on. And I suppose that would touch on what we're thinking about there is the differences between perhaps your young, healthy cat that has an injury versus your older cat that also has an injury, but maybe has some other things going on. So I think you're probably thinking here, and it's definitely stuff that we're going to talk to the pet owner about, is there underlying kidney disease, for example? That's a really important thing for us to be aware of. Or are there other injuries that might make us decide that we shouldn't use the anti-inflammatory, the non-steroidal drug? So I always think about that as, is there a reason for me not to use it? Because if there's a reason for me not to use it, then I won't pick it. But if there's not a reason for me not to use it, then I'm going to use that medication. So it's very much let's kind of consider all of the points. And if it's a good drug, it is a good drug, but providing there's not a reason for us not to want to include it in the pain management protocol, then I'm going to use that. But you're right, we should be really careful with using them. And cats, most geriatric cats will develop some degree of kidney disease. We know that's part of the aging cat kind of disease profile that we see. So it's important to consider it in that context as well.
What would be an alternative if I had a cat with kidney disease and they needed something to control that inflammation?
Yeah, that's a really good question, because that's where we don't have many other options. In dogs, we do have some other options that we can consider. We do have some data, interestingly, to support gabapentin for use in like musculoskeletal pain, where there might be a trauma in terms of effective pain control, there's some case reports out there supporting that. But in terms of reducing the amount of inflammation per se, like the non-steroidals do, we don't really have anything else that kind of fits into that bracket. Unfortunately, that's kind of where we sit. We can manage pain in other ways if we can't use them, and the gabapentinoids would be one example there. But compared to dogs, I'll just mention it very briefly because I think it's important to say that. So what you guys have called acetaminophen, which we call paracetamol in Europe, which is an effective pain management option in dogs, is something that is just can't be used in cats. It's not safe to use. So that would be our go-to in the dog when it can't have a non-steroidal.
Yeah.
We would use paracetamol, but unfortunately, cats don't tolerate it, and it can precipitate, or it does precipitate liver failure. So we don't use it in cats, or we are more limited.
Wow. So we hope that changes so soon. What are some other medications that we might be on the lookout for both pre and post surgery?
So I guess the one thing to mention, or two more classes of drugs that I would mention. The first are drugs that act on a particular receptor that we know is one of the ones that gets upregulated. So it starts to increase as we start to get chronic pain. And these are drugs in the class that ketamine sits in. Mm-hmm. So there are some oral versions that have an effect at the same receptor. And the two that are commonly talked about and that your veterinarian may talk to you about are amantadine and memantine. So those are both effective for use both pre and post surgery as well, in trying to reduce the impact of chronic pain as that starts to get what we call wound up within the nervous system.
I have heard of a lot more vets using amantadine for dogs than cats. Is that something relatively new in the feline world?
I suppose with the context here is we have very little evidence in terms of what we look at in terms of saying this is the dose, this is how often, this is how long, for example. But that's true in both dogs and in cats. There is more evidence in dogs. In fact, there's one study in dogs that shows the benefit of using amantadine. And unfortunately, that's not yet been proven in cats. Now, that's to say that it's not effective. I think those of us using it will hope to see the benefit, and I think we see that from a clinical perspective. It's just not been reported in the scientific literature at this time. So we're basing this very much on it's effective in people, it's effective in dogs. We see no reason why it shouldn't be effective in cats, and we use it clinically in cats, and we see a benefit in that situation. So it's another one that I would definitely be considering when we're trying to manage cats with amputation pain in the whole of their experience, the whole time pre-post.
Oh, that is really good to hear. I love that there's another thing in the toolbox for us to mention. What else? Is there anything else we should be looking out for?
The other area to mention, which are the opioids, or the opiates, and they're an interesting class of drugs. They're highly effective painkillers. Now, whether they're effective for the chronic types of pain that we are discussing is not established. And if anything, there may be evidence in people to support that they're not great for managing chronic pain. But in the initial injury period and in the surgical period, then opioids will definitely provide really good analgesia. And we would absolutely be using those as part of the management of the cat's pain in those time, but probably not using it in much past the initial post-operative period. It's not a long-term medication that we would be using.
That is really interesting. Now, when you give a cat an opioid, because I have never done this personally, do they typically have the kind of side effects that you might see in a dog, like the dysphoria, the whining, the crying, a little bit of restlessness? Do cats exhibit that the same way?
Yeah, they do. And actually, cats can be different about how they show. So you mentioned some of the things that we see in dogs there. Cats will be the same, usually salivation, maybe some sedation. They don't quite look as we would expect them to look when they're at home, for example. They don't normally vocalize like dogs do. You mentioned about whining and kind of seeming to be somewhat disorientated or disinhibited from the environment. We don't generally see those aspects. But what we see with cats is they get very dilated pupils associated with opioid administration. And as we know, most of the time when you see a cat go outside into the bright light, the cat's pupils really constrict. And when they're sat inside, perhaps in the hospital environment with opioid use, they have very dilated pupils. And then the bright lights, I'm sure for them, are something that is also not great for their experience. So we absolutely see some of those side effects. And I think what we're always trying to do is use an appropriate dose and at an appropriate time to try and reduce the impact of those side effects. And you mentioned earlier around pain assessment and pain scoring. So we have some really great pain assessment tools to use, particularly in the acute or surgical pain setting. So in the hospital, we'll be using things like the feline grimace scale that you mentioned and the Glasgow feline acute pain scale to pain assess and decide on the most appropriate time to give opioids if we're using them in the peri or the post-operative time. So we're not giving them unless we feel like it is needed, but equally we're not giving them because of the side effects as well. So the most common things I think we see in the hospital are inappetence and salivation, nausea. So we maybe are trying to manage those. We use the opioids and we accept that you get some side effect. And then we mitigate some of those side effects with other medications to try and reduce nausea, for example. So those are really the way that we're using it.
Now, do you think cats tend to get more nausea as a side effect than dogs?
Good question. I would say in my experience, probably not. We see it in both species.
Okay.
Very commonly, particularly post-surgery when we're using opioids. And I think, to clarify that for chronic pain, they're not brilliant. And we know that from human medicine. But in acute pain management, they provide very effective analgesia. So we are using them. All surgical cases, the majority of surgical cases will get opioids as part of that. So we become more familiar with trying to manage that part of their experience.
Okay. So we have these classes of drugs that you mentioned. Are there any others that might be used pre and post-op?
So not necessarily pre and post, but I think something just to mention, I think that will have an impact, particularly post, or it might be on the initial injury, are the use of the local anesthetics in terms of doing nerve block treatment. So certainly as part of a surgical amputation, we would be using a type, depending on the surgery, the location of the amputation, for example, we will use a nerve block using a local anesthetic as part of the pain management protocol. And that is very likely to have an impact into the recovery period, and that can be quite an extended time. Now, it may be that on an initial injury, you could also do some sort of a nerve block as well. So they do have a place, but it won't be something that you can do at home or have ongoing use of. So that would be the other class that we would be adding in.
Okay. So we have a cat who had a leg removed. We take our cat home, and one of the common scenarios that we as pet parents face is not knowing the difference between, are the medications working or are they not working? Is my cat acting a certain way? Lethargic, tired, doesn't want to get up. Is that good? Is that bad? How do we know that these medications are working? And what can be done if we suspect that they aren't?
I think that's a really good question. My first advice always to owners is that you know your cat best, and you know what your cat was previously like. How did it respond to seeing you? How food orientated are they? Do they want to go outside? Normally, are they an indoor cat versus an outdoor cat? Do they normally jump up somewhere? How do they sleep? Do they lie stretched out? Are they curled up? All of those things. So I think cat behavior is really, really key to understanding whether they're comfortable versus whether it's a side effect of the medication or whether they're not comfortable at that point. Now, I think we all know that there's some really interesting, some great videos and pictures about what's a normal cat position, for example, to sit in or to lie in. And if your cat's not doing that and it would normally do so, for me, that's a real key to say, actually, they're not happy. Facial expression, obviously the feline grimace scale is a great example of what cat expression might look like if they're in pain. Now, that's for acute pain, but if you're talking about the first days post-surgery, it's still applicable to consider using that. So ear position, great one, whiskers, shape of the muzzle, those are the key things that we know are really useful to look at and decide if we still think that pain management's not in the right place at that point. So I would absolutely encourage owners to look at those things when their pets are back at home. And the other thing to mention is, if you imagine, once the surgery is completed, the tissue healing process is going to take quite a long time. So even though the sutures may come out after 10 or 14 days, the healing process is going to take a much longer period of time post that as well. So stopping painkillers maybe at 10 or 14 days may not be appropriate depending on how the recovery is going. So I think about encouraging everyone to go, actually, do we need to give these medications for a longer period of time? We obviously have to be aware of side effects, potential for that. We talked about the non-steroidal drugs and kidney disease, but we also need to think about the fact that the tissue healing process could take weeks, stroke months to be complete. And I think that's a real key here for not stopping medications too soon in the post-op period.
That makes me so happy. I wish people could see my expression right now. I am so glad you said that, because we tend to see that is the thinking at 10 days post-op, boom, medications stop and your animal's going to be fine. And that's what we all hope for, of course. But cool. Yeah, and they might look normal and might be trying to do things they did in the past, but it is important to keep in mind that the healing is still going on. This is such major surgery that we humans would not be okay in 10 days if we had a leg taken. So with the pain control that we get from our vet and we're home, how long does it generally take for the medications to kick in and be effective and control the pain during, the weeks after surgery?
I mean, I think that, so it'll depend on the drug. I suppose that's one thing just to make everyone aware of. But these drugs, if they've been started pre-surgery or started as part of the surgery or immediately post-surgery, the majority of the medications we're using will be effective very quickly. So within hours, okay, the majority of these products that we will be incorporating. So they should be effective. So if you were to take your cat home, for example, on, let's say, the day or the day after surgery, then I would expect those medications to be effective. If they're not managing the pain effectively at that time point, then that for me would suggest that we need to revisit with our veterinarian and look to see whether maybe the cat needs to go back into the hospital and have medications that we can administer via other routes, so injections, for example, or it may be that we can inject something and the cat is still able to go back home with the owner. But really, we should be at the point, for me, the discharge from the hospital or from the clinic is when we can wean off the injectable painkillers. So for the majority of the cats, I think that I certainly see, that we see in the hospital, they may be with us for 2 or 3 days post-surgery before we send them home, so that we can give them stronger painkillers that we can't obviously give to the client to administer in the home setting. So that's really important as well. And what I'd be wanting to see is that we start to wean down the medications they're getting in the hospital and allow them to switch to the oral medications effectively. And then once we know they're comfortable on that, or as comfortable as we can get them, then we're going to discharge them from the hospital at that time point. So if owners are worried at home, that's a red flag to go, I think we need to just get some time with our vet and decide if this is okay or we need to do something different.
Okay, now that is so helpful to know. I love that perspective, and it's really good to know that you in the practice can keep cats as long as 2 or 3 days to manage pain as well as it can be. And I'm curious because something I'm seeing a lot of, especially these days, is a lot of people can't afford to leave their animal in the hospital for more
Okay.
than even a day. And in those cases, what are they facing as far as controlling pain at home? How can they make their animal more comfortable?
And I think the key there for me is what we can do when they're in the hospital. So even if they're only in the hospital for a day, for example, because there's lots of limitations that mean they can't be kept in, that we can do the bits that make the difference. So the concept that I like to think about is the better we can control the surgical pain and the acute pain that happens around the surgery, the less likely we are to develop further ongoing chronic pain in the post-op period. So the more that we can do in the clinic, the more effective our pain control is, the better outcome is for that pet to go home. So there will always be times where animals, cats, dogs, whatever, they have to go home sooner than perhaps we would want them to do in a different setting. And that's something I think we certainly experience that as well. And it's not to say that we always can keep them in. I'd love to do that, but that isn't always possible. But there's definitely stuff that we can do that means that when we do switch to oral medications and oral painkillers, that the other bits we've done in the background before that will have a longer effect and will be there in the background for a period of time. So I would encourage everyone to speak to their veterinarian about what they're going to do in the hospital setting that would allow them to then get a better control for when they are discharged from the hospital. But that's not to say they can't necessarily, if they're worried, definitely get some advice. And there are things that can be injected where you can still then go back home again. So you might need to maybe visit the clinic once a day to get an injection that will make a difference in those initial few days, while that kind of the most of the inflammatory and surgical pain is starting to improve.
Oh, that is so good to know. So even if somebody has to take their animal home, same day even, we see that quite a bit, unfortunately. And it's hard. It's so hard on the pet parent, but it's good to know that they can at least, try to get the animal back to the clinic for some injectables that will make a real difference. And this kind of points back to one thing we really advocate for ahead of surgery is to, like you said, talk to your vet about what kind of pain control they practice for a surgery like this. Because not all vets practice pain management the same way. Not all vets know about the zero pain philosophy team. And I really, really encourage people to look at the resources at tripawds.com, which I will point to in this post. But we do have things they can look at that will help them have a good conversation with a veterinarian about pain control, because we aren't pain experts, but there are questions you can ask that might tell you a little bit more about how their vet feels about pain control for something like this. Because it is major. And like you've said, better pain control during the procedure does lead to better outcomes. We see that a lot. And one of the outcomes that we tend to see for all animals, for a lot, I should say, I don't want to make a blanket statement like that, but for a lot of them is phantom pain. And phantom pain is something that for a long time was thought, oh, animals don't feel it, even though on the human side, we knew that human amputees felt phantom pain. And I would like to have a conversation with you about that now. What is your understanding of phantom pain in the veterinary world, especially when it comes to cats?
The first thing to say is we definitely see it and they definitely can experience it. So there's no, and as we were talking about earlier, the way that the pain process happens is exactly the same. Is how that might be manifested in terms of the experience, the perception. That's the difference. But we see it in dogs and we see it in cats. Absolutely. Why do we see it in one particular pet and in another and not in another? We don't I don't know that. There will be things that are the same and things that are different, and all of those things come together, and then we see this consequence of phantom limb pain. What we do understand is it's related to what we were talking about before in terms of having to cut the nerve or cut nerves as part of the procedure, but it might be because those nerves were already damaged before the amputation, and that's initiating the reason that then at the surgery we then develop phantom limb pain or amputation pain, however you would describe it. So there will be a difference as to why one cat will experience it versus another one that may not, when they've had the same surgical procedure effectively, but perhaps their experience beforehand was different from the injury perspective. So yeah, definitely and again, it's all, for me, focus on recognizing that that's something that we think the cat might be experiencing. And the key is going to be cat behaviors here as well. So the things that cats do when they're not happy about something, they look around. Maybe they look at where their leg was, for example, very common in people. Maybe they're scratching the region and they're biting at it. It's another common thing that they may do. They start to overgroom themselves, as cats often do when they perhaps get stressed, for example. So it's the key to seeing those aspects that allow us to perhaps, it's always going to be a diagnosis of excluding other reasons for them to be doing it. We'll never necessarily be able to diagnose they've got phantom limb pain as such, but it's ruling out that they haven't got skin disease and other reasons for them to be particularly interested, licking the area, that sort of thing, that might be because of another reason and not because of the limb pain.
That is so good to know. And the grooming and the behaviors that are a little more unique as compared to dogs, when we suspect that a cat is having phantom pain. There is a behavior that we've seen in our community where a cat, shortly after coming home, will act like they'd been shocked by something, and they will throw themselves on the floor, or they will walk backwards like they're trying to get away from something. And I will put a link to the video we have that somebody took of their cat doing this. But have you seen that in your own clients? We're calling it the backward walking phenomena.
And I saw that in your notes. And I think what it made me think about is it's a behavior I've seen in cats. I don't know that I haven't seen it in a cat that's had an amputation, but what I have seen is they're often, they become disorientated. They're not so stable on the three limbs, particularly, I suppose, in the initial period post-surgery. And those are the bits then I recognise where there's something they're not okay. There's something that's not quite right for them. But it's not related to amputation. But what I have seen in cats, and one of our cats used to do this, if you put a jumper on him at Christmas, for example, he would walk backwards. He wouldn't walk forwards with the jumper on, but he'd always walk backwards. So it's obviously, there's something about the cat and the way they behave that makes me think that what you describe is something that cats might do in situations where they don't know they can't really work out what's going on, and they're not comfortable, whatever the reason is for that. But it didn't. When you mentioned it, it did make me think about what one of our, he's no longer with us, but one of our previous cats used to do this. So, but you're absolutely right. The behaviour changes. I think we know from people, and you know yourself, if you get nerve pain, so like dental nerve pain, for example, if you've had maybe some sort of dental treatment, either an extraction or you've had, dental filling, you get those electric shock type feelings associated with the fact that the nerve endings are exposed. and that can be completely random. You don't know why you might experience that, but it kind of makes sense from what you describe that it's almost like like a bolt of lightning, for example. And that's the strange thing about nerve pain. It's very hard to treat it for that one time when it's going to happen with some of the other medications that we use. And when it does happen, it's very intense. A lot of pain is kind of dull, aching pain that we kind of will experience post a procedure. But in that initial period and with nerve pain, it's very intense and it's very short-lived. And that makes it really challenging to manage that alongside of the more achy type dull pain associated with the tissue healing process.
So we tend to see that kind of reaction, the jump and the sudden yelp in both cats and dogs when they're having some kind of pain after surgery. How many times would you give an episode like that before you called your vet and said, I don't think my pain management is working. What can we do? Is it okay if it happens once and then never happens again? Or what? I mean, what are the guidelines you would give to somebody?
Yeah, good, really good question. I think if it was a single occurrence, then I would probably not be too worried about it at that time point. But if it starts to become something that's regular, then I would absolutely be going back to speak to my veterinarian and just get some advice from them as to what could we add in at this time point, or in some cases we may need to start to think about down regulating some of the medications as well. So we're usually thinking about adding stuff in.
Yeah.
But we do know, particularly with chronic use of some medications, they might also impact behavior. And we may get to the point, weeks, months past, where we also want to perhaps try and withdraw some medications if we're still using them, just to see whether that also has an impact. But you're right. If I'm seeing it once a day and it happens for a few days in a row, or twice a day for a few days in a row, then I'm definitely going to be thinking this is not okay, and we need to do something different.
Okay, that's really good to know, because it is a scary thing to happen to your pet and watch them. So good advice there. I am so shocked that our time has flown here, and this is longer than we normally do for our podcast, but you're full of such great information, and I really want to make sure that cat parents get the insight that they need to feel better about a situation like this. Carl, what is your final little bit of wisdom and advice about pain control after amputation for cats? What would you tell the new tripod pet parent who is in this situation?
Yeah, thank you. Thanks for mentioning that. I think number one for me is absolutely back to you know your cat the best. So if you're worried about them and you don't think you're being listened to, then then get some advice from another veterinarian. Go and find that information out. So I would absolutely encourage don't feel like you're not being listened to. So get in touch with somebody, obviously via Tripawd, via one of the organizations that's out there that might be able to direct you to getting the support that you need. So please don't think that what you're seeing is normal or you're being told it's normal. Get another opinion and seek that out to do the best, because it's a tough time. You go from potentially from your cat looking like a normal cat, I'm going to say, to a cat then that's different. They do behave differently. They have to adapt to having lost, to having had that limb amputated. And I think they do a great job of being able to do that, but it takes time for them to adjust. And I guess you as the pet parent to also adjust to that. So don't be afraid to seek out some additional support and help if you need it.
Well said. Well said. Thank you for your time today. I am so happy that you're here, and we managed with the time difference and everything to get you here. This is so helpful, and I would just like everybody to check out the website, the zeropainphilosophy.com, and there is a great section there for pet parents. It's not just for veterinarians. And if you are lucky enough to be in the UK, there is a directory of veterinarians on the website that you can go to who are up on the latest pain management techniques and can help your cats and your dogs feel better after amputation surgery. Thank you so much for being here, Carl.
Perfect. Thank you so much, Renee. It was amazing. It was a great conversation. So thanks for your time.
Oh, thank you.
And that's a wrap for another episode of Tripawd Talk Radio. We owe Carl a huge thanks for sharing so many great tips about pain management for tripod cats. We are so grateful for great practitioners like him who go the extra mile to help bring pain management into the discussion for pet parents and vets alike by sharing knowledge that improves quality of life, no matter how many legs your animal has. Remember to think about your pet's pain in 3 phases: pre-surgery, the anesthetic period, and post-op at home. Even short pre-treatment can help, and what happens during surgery, like nerve blocks and strong hospital medications, can influence recovery later. So talk with your vet to ensure your pet is getting proper pain control. Find links to Zero Pain Philosophy, the Feline Grimace Scale, and more Tripawds resources in the show notes. Thanks for listening, and for helping your tripod enjoy the awesome life they deserve. And if you're in the middle of this journey right now, please remember you are not alone. Check in with the Tripawds community to get help and connect with members, or call the toll-free Tripawds helpline anytime. Learn more at tripawds.com.
He's a three-legged dog and he's still pretty good.
Thank you for tuning in. Subscribe to Tripawd Talk Radio for more pet amputation tips from experts, and claim your free gift just for listeners at downloads.tripawds.com/podcast.